raise your eyebrows up for me. Okay, good. Just saying there. Just move around. How to teach me new tricks. Okay, so we've had this for 4 or 5 years or so, you said.
Yes.
And it feels like a little lipoma. So I'm gonna you're gonna hear a little buzzing noise.
Okay.
It's just a cautery that stops little baby blood vessels from oozing a little bit. Gonna buzz it here. Nothing hurts, right?
Nope.
Okay, good. Let me see if I can get to this now. I think I'm right over the top of it. As you saw, we let you sit for a little bit because the scalp likes to ooze just a little, nothing crazy, but it's just more so than other areas because it's just like, you know, if you have kids and they hit their head and then all of a sudden they say, oh my gosh, I was bleeding like crazy.
Yeah.
It's because there's a lot of little blood vessels there. So I like to buzz it just because it makes it easier for us to see what we're doing.
Okay.
I see it. It's under there. Let me see if I can get to this little friend of yours. I see the top of it. That is nothing bad. We're not going anywhere crazy.
Okay.
Just see the top of it. You know, I very typically, when I do the ones on the scalp, I make a tiny little incision, so I can't always like pop them out whole. We kind of have to like just snuggle around. Yeah, and it's just because I don't want to have to, you know, make a bigger incision to cut something out. So you just hear me snipping around. Sometimes I'll push on you because we might be able to pop it out. You know, we might be able to pop this out a little bit. Here he is. You okay?
Yep.
Okay,
good.
It's a pretty little egg yolk. I call them egg yolk lipomas up here because they look like egg yolk. But a lot of times they're just stuck to us. Do you have any kids or anything?
I don't.
You don't? It's okay. Don't be
Not
sad
yet.
about
I know.
it.
I'm like, not yet. I feel like I'm getting older though. That I need to start having kids. But
do you have nieces and nephews? And
no,
things?
none of my siblings have kids either.
Oh,
I know.
Somebody scared you guys off.
My mom.
How many kids, brothers and sisters do you have?
I have 3. I have a twin sister.
Oh, you do?
Yeah, we're fraternal. But yeah, so I have a twin.
Awesome. Is she also in the same work that you do?
No,
or?
she thinks it's disgusting.
Oh,
so she would
funny.
never do it. No, she leases apartments.
Oh, okay. Yeah. Well, those are always good to have in the family.
Exactly. And then I have 2 older sisters.
Okay. Oh, you're all girls.
They're all girls, yeah. And then I have 2 half sisters.
Oh, wow.
I know. No boys at all.
Sorry, I'm doing a little tug here on you. This back. Thank you. I'm trying to get to this whole thing using that little incision that I spoke about. So make sure I'm not hurting you at all, but I'm trying to reach right there.
That's good.
Let me feel it first, actually. Dermatology, thank you. See if I can get back into this corner here. Here we go. Hold that. I was gonna do. Let me hold this with me. Okay. You're doing awesome. Almost got it all. Nobody else has any bumps like this either, huh?
No.
Was it? It's nice having a little twin though, growing up, even if you are fraternal.
It is. It's like a built-in best friend.
Yeah.
Yeah. And we live together now, so.
Oh, you do?
Yeah.
How lovely.
That's nice.
I mean, does she? So you tell her about things, and she's like, I don't want to hear about
she's
it.
Like, I don't know how you do that. She's like, stop, don't tell me. I don't want to know.
Funny.
Like,
so you guys can't watch Pimple Popper together.
No, she doesn't like it.
Of course, I would think she would.
I love it though.
If she can't even hear what you're talking about, well, I mean, you do probably different gross things, but gross things too.
Yeah, but I love it though. I'm just
you
like,
do. That's wonderful that you love your job. We need you these days, as we're saying.
Yeah.
I just want to make sure I got it all, and you know how that means I have to just sniff around here a little bit, as you know, girls. But there you go, this back again, thank you. There's like a little, the muscle overlying it, just trying to get all the edges here. Just have to be meticulous and do it. No real shortcuts here. Okay.
I'm so glad I'm finally doing this though. 'Cause
Yeah.
I've been so like self-conscious about it.
Yeah, but thankfully you do have this beautiful hair that has been hiding it. But I can imagine like a swift breeze or something kind of makes you feel like, oh my gosh,
or certain hairstyles, you can
yeah.
see it more in the light.
And then you're like, and then you really want that hairstyle.
Yes.
For some reason. Okay, let go for you a minute. Let me see.
I feel like everyone's just staring at it instead of me. So I'm like,
They're not, but you think they
but
are.
I think they are.
Yeah,
Yeah.
I get it. I get it. Because this is kind of a nice long shape, I just have to reach under and see if anything pulls out of that area. Down to that top of that, let me see. Doesn't look like lipoma's there, but I don't believe I got everything over here. Wait a minute, I think, no, maybe I don't. Let me try to pull that back and go this way for a minute. Well, I think we're almost there, but I just want to make sure, obviously, by pushing this way, and if I need it, I'll grab the black tip from me. Oh, that looks pretty good here. That looks good here. Oh wait, here's something. Put this down there and grab that. Tiny little morsel. But almost have it all. So I use my finger to push up on this end and see if anything bulges out there, but I don't see anything. Over here, nothing. Nope. Over here, I think we're pretty much almost done here. You don't see anything under there, do you? I don't think so. Go on this side. Looks pretty good to me. Okay, I just feel off it. Push this on something here. It's hard for me to tell, you know what I mean, girls, right here, but I don't see anything. But I just want to make sure that's numbing. Feel around on yourself. See what I took out here. Looks pretty good. There was one big flat piece that I took out. It was like not very raised, but wide and flat here.
Feels
Think
good.
about the size. Yeah, you don't see anything. We lift up or push around. Maybe this. Maybe when I push down here, but I think that's just the tissue there. I'm glad you're a nurse and you don't mind me yapping away like this. I
No.
wouldn't normally do that.
No,
I'm just
not at all.
talking out loud to see what we have here. I think it looks pretty good too. Just don't totally believe it yet. Is that really it? it. I think so. It's hard to tell with this one because it was so flat. But it looks good when I... Yep. Okay, okay, okay. Stitch in there, and you're out of here. Does your sister know you're doing it today?
Yeah, she
Probably,
does.
right? Okay.
Yeah.
Does your mom live close by too? You get to see her?
She lives about 30 minutes.
Oh, that's not bad.
Yeah. She actually dropped me off today. Yeah, she was like, "Do you want me to come?"
Does she watch any of that with too?
She
or-
doesn't,
Oh,
but
okay. That's okay.
yeah.
Only the smart ones are the geniuses in the crowd. There can be some. Not everybody can be the smartest. No, just kidding. Don't say that. I'm sure your mom is plenty smart.
She is.
Yes. She just doesn't like this stuff. But you know, we are in general, the smarter ones. No, I'm just kidding.
I agree. My other sisters were like, "Wait, is she really gonna do it? Dr. Lee's actually gonna like perform it?" And I was like, "Yeah, that's what they told me." I'm like, "Oh my god, so cool!"
Oh, you should just be happy you didn't make the show. That means you had to have something really big and crazy.
Exactly.
I'd rather do these all day. Kidding me? I like your shirt that you have there. Do you like that one, that cut there? I don't think I can wear that myself though.
Oh.
No, I was talking to my girl here who has the. Have you seen those figs that have the arms? Like, what is that style called? This one that you're wearing? There's a name for it, right? It's like an Asian name, maybe. It looks like a little bit of it's an Asian.
Oh, like the sleeves that go like this? Yeah, I don't know if
I don't think I can pull that off.
Yeah, I have a lot of figs, but I don't.
Yeah, I don't think I could do that.
I don't know if that style is for me.
I
So.
need to emphasize like broad shoulder, you know, kind of thing. Okay, so when you see it today, it'll still be a little bit swollen.
Okay.
Because I put numbing under there, but we are going to put a good compression bandage on there, which is important to keep it from oozing under there. And I bet tomorrow when you see it, it'll be flat.
Okay.
Nice and flat. Also, I should tell you, interestingly, well, just so you know, so that you won't get alarmed at this. Sometimes a few times when I've had these heal on the forehead, they'll look really great and flat, and then all of a sudden they'll get puffy like a couple weeks out, and it's like serous drainage. It's just like fluid because it was flat. It's not like the lipoma. Some people go, "Oh my gosh, the lipoma grew back," but no, it's like the fluid, and it like absorbs.
Okay.
It should not. Certainly, if it were to grow back, which is doubtful, it's not going to grow back like that quickly.
Okay.
To get a bigger bite of that side. And then these sutures come out in 1 week, but like I think I might have said, come see us in 1 week. But now that I know you are a nurse, you can certainly have somebody, or you may even be able to take them out, the top stitches. There are stitches underneath, but up to you. We're happy to see you.
I'd come back.
Yeah, that's fine. Any other people in the medical field in your family?
No, I'm the only one. I know.
I'm sorry for you. You get all the questions.
Me too. And they were like, they asked me questions. I'm like, wait, I'm not a doctor though. I'm a nurse. I mean, I know
you're
stuff.
The closest,
but I'm just like,
so see. Yeah. I mean, if I had a painter in my family, I would be asking about the toilets and just like the same area.
Yes.
You're around people that do that when you're doing construction.
And my dad's like, can you take some medication from the hospital? I'm like, Dad,
That's so funny.
He's like, don't you have access to that? I'm like, yes, but no.
Dad, no, I need my job.
He's just testing you. But you can feel it here right now. I have the gauze over it. You can feel that it's flat, just puffy overall, but it's I don't feel it under there. It's just like numb there.
Yeah.
And it's kind of has, you can hear that noise, a little bubble kind of. Oh, she's gonna take a picture of it, actually.